So, good evening everybody, I'm Dr. Lee. So today we are going to start our basic life support course, okay? So I will be teaching basic life support based on 2020 American Heart Association guideline, okay? So next, before we go on, let me play some video for you. There's no sound. The projector got no sound. It's okay lah, just go on with this. So basically what's going on now is Mr. Bean wanted to go to work. However, his car broke down. So now he's heading to the bus stop to wait for the bus. There's one guy standing beside him who came before him. Let's see what happened now. So this guy suddenly hold his chest and fall down onto the ground. So Mr. Bean is checking whether he is conscious or not. Yes. And checking the pulse also. He's asking for help, but no one stops. What do you think he's doing now?
He's trying to give water to something.
Okay. And what is he trying to do now? This is CPR. Yes, he's trying to do CPR and
Let's keep breathing.
keep breathing. But he don't want to touch the guy, so this is what he do. He try to collect the air, and hopefully the air can go into that person's mouth, the victim's mouth. Okay, he figured out another way to give briefing to the victim, which is through the magazine. Okay, and he's observing for.
Chest rising of the
Raising.
Yes, correct. He observed whether after he give briefing the chest rise or not. Basically, he just checked what medication the patient is, the victim is bringing. So he is trying to help to give medication. What do you think he is asking for? He's calling for help. And he brought one crocodile clip, okay, and wire, the wiring with crocodile clip.
Oh no.
He connected the crocodile clip to the light pot. Then he shot him, and he woke up. call ambulance. And ambulance came. And he reused his crocodile clip to start up his car, okay? Yeah, basically that's all. Alright? So, okay, so Mr. Bean is trying to do basic life support to the victim who actually became unconscious due to cardiac arrest. Do you agree?
Yes.
Okay. Is he doing everything right? No, right?
Of course not.
No, okay. So, okay, let's see what we can change for him. Okay? So, before I continue, just let me introduce myself. I'm Dr. Lee, born in 1992. I practice as a doctor since 2017 and working in clinic medical surgery as a GP. And I'm a certified basic life support trainer since September 2024. And at the end of the session, I hope all of you are able to perform CPR on my infant and adult mannequin, to operate the AED on infant and adult mannequin, and to relieve choking on the infant and adult mannequins. So, and at last can explain to me what are the significance of time in initiating basic life support. Alright? So before I go on again, just have a small icebreaker session. Okay, let's see what is happening now. So you are working halfway, you turn to your left and you saw your colleague basically holding your chest and collapse towards the office table. Alright? So you actually went to your colleague, try to call your colleague and ask what is happening, but your colleague is not responding. And you check the pulse, it's not no pulse at all. And you try to observe whether your colleague is breathing, no breathing at all. Alright, so in this case, what are you going to do? Shafia, what are you going to do?
Over,
Okay.
check for response, and then clear the place.
Everyone coming, busybody. Oh, how are you? How are you?
I have to give a space for her, and
Okay.
then call for somebody to call for help.
Okay, how to call for help?
What's that called?
Ambulance. 999 ambulance. You want to call Thompson or you want to call hospital Sungei?
So this will do the 999. We decide actually, right?
Okay, alright. Then how about you? Kumar, what are you going to do?
I'll do the same what she's doing.
Okay, then how about you, Dr. Gauri?
First, I ensure that the area is safe.
Okay. Okay.
Okay, then after that, again, check for responsiveness, check for breathing and pulse within 5 seconds.
Alright.
Then after, I call for help.
Okay.
Okay, and then tell them to call the ambulance, get the AED,
Okay.
and proceed with my chest compressions.
Okay.
30 chest compressions. And then,
Get ready.
yeah.
Okay, don't worry. So, okay, never mind. At the end of the session, we'll come back to this. Let's see what you can do for your colleague. Alright? Okay, so next. So I'm going to talk about 3 parts. The first part will be what is basic life support. Second part is how to do CPR and how to use AED in cardiac arrest situation. And lastly, how to relieve choking for victims. Okay? So now let's start with what is basic life support. Basically, basic life support involves 2 big compartments. The first one is we use CPR, we do CPR and use the AED machine on cardiac arrest patient, cardiac arrest victims. And another big part will be relieve the foreign object obstruction in the airway in choking patient. basically I'm going to teach these two big parts. And what is CPR? CPR is a short form, right? So in a full form, it means cardiopulmonary resuscitation. Okay? Cardio is heart, pulmonary is lung. Resuscitation means try to revive back your heart and your lung. Alright? So this CPR need to start very fast within a few minutes of emergency to increase the victim's survival rate. Okay, next. Common cause of sudden death. Okay, before we go deep into basic life support, CPR, everything, we need to know there are some victims, they suddenly collapse in front of you and they die on the spot. Okay, what caused them to die? First of all, can be heart attack, can be foreign body airway obstruction, block your breathing, can be drowning, can be stroke, can be drug overdosed, can be suffocation due to burn all the smoke, everything, smoke inhalation, electrocution, you touch the electric port, very bad allergic reaction, and very bad trauma. Okay, for example, car accident. Okay, so what is cardiac arrest? To define cardiac arrest, we need to have 3 criteria. Anyone can name me? What is the first criteria? Don't remember. Don't remember. Don't remember. Okay, never mind. The 3 things to confirm whether this victim is in cardiac arrest state.
ABC.
No. What are the 3 criteria to confirm that the
The
victim
person is having
cardiac arrest?
pain, fall, unconscious.
Unresponsive.
Unresponsiveness and
No breathing.
unconsciousness is the same thing. Okay, number 2,
Absence of breathing.
absence of breathing,
Absence of
no
pulse.
breathing. Okay, number 3,
Absence of pulse.
no pulse. So no pulse, not responding, not breathing. So okay, you are our best student. You are our best student starting with
Hesitation.
Okay. No wonder lah, our best student, right? Okay.
Agreed.
So in cardiac arrest, what we can do, we can prepare these 2 things. Okay, the first thing is we start CPR. CPR, cardiopulmonary resuscitation. Another thing is we need to bring the AED. AED is automated external defibrillator. It looks like this over your right hand side. Okay. So now, what is choking? Choking usually comes with the universal sign of holding the neck. Okay. Someone is choked by foreign object in the airway. They want to bring that thing out, so they will do something like this. Okay. So what are another 2 criteria to confirm that the victim is choking? Can you tell me?
Breathing not proper.
Yes, can. And?
Cannot cough. Cannot cough.
Cough.
Yes, constantly coughing. You want to cough out the foreign object. Alright, so cannot breathe smoothly, you are right. And constantly coughing. You want to cough out that thing. Okay? So these are the very obvious signs of choking.
I'm also in school.
Okay, you're a good student. Oh, sorry, don't worry. So now, so there are clinical death and biological death. Okay, how to define clinical death, how to define biological death, I will talk later. Before we proceed with that, let's play some small games. Okay, so I'm going to play the timer. Then you hold your breath, and you see how long you can hold. Alright, so not starting yet.
Just taking deep breath.
Alright, now let's start. Okay, everyone seems longer than me. Still holding, very good. Okay, Shafia, berapa saat?
20.
Okay, 20 seconds for Shafia. Still holding ah?
Woman or any?
Okay. So who start first? Okay, both at the same time ah. So both 38 seconds ah. Alright, so that is the feeling of how you feel when you choke. Alright? So that's the feeling before patient choking and went into collapse. Okay. If the choke, we don't relieve the choke now. If we drag longer, the suffocating, we drag longer, we will collapse. Okay. So when we collapse, officially we become dead. All right. So let's see. Okay. Death. The meaning of death is not breathing and no heartbeat. Okay. This is very simple, right? So once you no breathing and you don't have heartbeat, you are officially dead. But how to differentiate between clinical death and biological death? Clinical death is basically reversible. Okay. Okay. When there's no oxygen supply, within the first 4 minutes, okay, the brain cell will die. After 4 minutes, no oxygen supply to the brain, you will have brain cell damage. Okay. However, during this clinical death, it is still reversible if we try to help patient, we try to do something to the victim. If let's say no one helps the victim, after 4 minutes, the brain cell continue to die. So up to 10 minutes, still no help to the victim, no oxygen supply to the victim. So the death became permanent already. So it is called biological death. Understand? 4 minutes, brain cell starting to die. After 10 minutes, no more helpful already. Okay? No more helpful already. The victim is biologically died. Okay. So there are chain of survival for us to help victims. Okay? There are adult victims and infant victims. Alright? The chain of survival out of hospital and in hospital are actually different. Okay? Out of hospital, what are we going to do? We follow step by step. Okay, first, out of hospital, we activate emergency response. Means call 999, call for help. So next, we start high quality CPR. After that, we try to find AED to do defibrillation. Then, wait for the advanced resuscitation. Means wait for the ambulance, more professional team to come and help the victim. Then, they will send the victim to the hospital for post cardiac arrest care. And lastly, the victim recover. Okay? So that is out of hospital. That is what we can do. Okay, in hospital something different. Okay? First of all, they need to have early recognition and prevention for cardiac arrest or basically collapse. Okay? So next, in the hospital, they will activate emergency response. Then they will start CPR. Then they will do defibrillation like what we do. Then post-cardiac arrest care and recovery. Okay, these are the two different chains. For pediatric victims, the chain more or less the same. Okay, out of hospital, what we can do? Prevent first. We need to execute all the possible accident that might happen to the child. For example, at home, you know you cannot put the child on the baby cot that's too high, that might fall. You need to prevent hot water pour on the child. All these things can be prevented. Okay? So prevention is number one. Number two, if something happens, we activate emergency response, means call 999. Then start CPR. Then wait for the ambulance to come. Then post-cardiac arrest care and recovery. In hospital, same thing. They will recognize and they will do prevention first. Okay? After that, they activate the emergency response, start CPR, then active resuscitation, post-cardiac arrest care, and recovery. Okay?
I ask some question here.
Yeah.
So first thing is, after the high quality CPR,
Yeah.
why got no rapid defibrillation?
It's actually included in the advanced resuscitation, included in the high quality CPR, but no place to put.
So that means it's not 6 chain, it's 7 chain already, right? Another thing is, see
Okay.
the in-hospital map,
Yeah.
it's written next to high quality CPR, written advanced resuscitation.
Yes.
But you see the picture is rapid defibrillation.
Just the picture different only.
So
But
the picture is wrong.
no, the picture is wrong. This is actually stated by AHA. But never mind. The picture is not the main point. The main point is we know we need to do advanced resuscitation.
It means ambulance picture,
Ambulance
right?
is because outside of hospital, ambulance will come and get you, right? But inside the hospital, we don't need
So that
ambulance,
means
right?
rapid defibrillation is considered advanced.
Advanced.
Yes, correct. It's considered inside the advanced resuscitation. Okay? We don't need ambulance in hospital setting. Alright, now let's go to part 2. Part 2 is CPR and AED used in cardiac arrest. Okay, so before we want to help victim in cardiac arrest, we need to identify whether they are infant or child or adult, correct? Because the way of helping different age group will be different, okay? So infant basically will be at day 1 of birth until 1 year old. We categorize them as infant. So another one will be child from 1 year old up to puberty. Alright? Puberty, what are the signs of puberty? Can you tell me, Prof. Kumar?
Male and female difference. So
Okay.
puberty signs in male, pubic hair growth, then scrotal changes will be the darkening of the skin,
Okay.
and then the hair growth in the face.
Okay, understand.
Facial growth for the female, widening of the hip and breast development will be there.
Alright. Okay, that's all. That's simple only, okay? If we see features of puberty, like, in female we see breast development, okay? In maybe male we see very obvious one, we got some facial hair, okay? Then there is a sign of puberty already, okay? So next, adult, of course, we know who is adult, right? Okay, so before we proceed, just some small quiz now. Okay, Shafia, this is child or infant?
Child.
This is child, okay, very good. So, so Prof. Kumar, this one is child or infant?
For me, it's like infant.
Okay, good. This is infant. So, Dr. Gauri, this one?
Adult.
Okay, this is adult, alright? So,
Easy question.
easy, right? So easy, right? Everybody know how to differentiate when something happened at the public area, you all know how to differentiate, right? So now we can proceed to help them really. Okay, so there are mnemonics that we can help victims when we want to start basic life support. When you want to start the CPR, right? These mnemonic are DRCAB, okay? DRCAB. So DRCAB is a sequence to help you to not to be panicked and remember what are the steps when we want to start resuscitation on cardiac arrest victim. Okay, so yeah, Prof. Kumar, can you tell me what is D? You forgot? Okay, never mind. Shafia, can you tell me what is D? Forgot. So how about you? Danger, yes, correct. Okay, so when someone collapses in front of you, first of all, you need to check whether there's danger around the victim, okay? Because as what I say, the collapse can be caused by many causes. It can be drowning, it can be electrocution, right? If there's any electric around surrounding the victim, you need to bring, or something dangerous surrounding the victim, you need to bring the victim away from the scene, okay? Away from the dangerous scene, okay? This is the first part, danger, okay? And also make sure you are safe in that scene, okay? Don't make yourself collapse also in the scene by the electric caution, okay, for example, right? So number 2, R.
Response.
Response, yes. Response means check after you remove the victim away from the dangerous scene, you need to check for response. You need to see whether this victim is really not responsive or not. Okay, so first of all, Shafia, in adult victim, how are you going to check for response? Okay, you're going to tap the victim on shoulder, yes, okay, no problem. So you're going to tap the victim to see whether the victim is awake or not. Alright? Okay, this is one of the way. Alright? So apart from checking response, we need to know whether this is cardiac arrest, right? So there are 3 criteria for cardiac arrest. Prof. Kumar, what are the 3 criteria? Response is number 1.
Yeah,
No response. Okay.
And then pulse, no pulse.
Number 2, no pulse.
And breathing.
No breathing.
No.
Yes, correct. Okay. So now response you check already. Next, you need to check whether
Circulation.
you need to check whether the victim has breathing or not, and whether the victim has pulse or not. Okay. So Dr. Gauri, how are you going to check whether adult victim got pulse or not?
Okay, so first you must identify the trachea
Alright?
and then move slightly laterally and then check the carotid pulse
Yes, for adult can check for carotid pulse.
within
Okay.
10 seconds.
Within 10 seconds. Alright? So how to check breathing, Shafia?
Check everything.
Okay.
Look for the raise of the chest.
Look for chest rise. Okay, correct. So if let's say you check response, no response, you check carotid pulse for adult, no pulse. You check for chest rise of the victim, no chest rise means not breathing. So you confirm already, this victim is in cardiac arrest. Then you need to start on CAB, right? What is C? C is compression. Okay, basically means you need to provide high quality chest compression. Okay, next you need to maintain the airway of the victim. Means you need to open up the airway of the victim, and lastly give breathing to the victim. Okay, so these are the mnemonics DRCAB. Okay, so if let's say you are one person, you are going to help this victim, adult victim that had cardiac arrest. So what are you going to do? Because there are no one surrounding you going to help you. So first of all, you need to verify the scene safety. Okay, you need to screen for any dangerous object or dangerous scene around the victim. Number two, check responsiveness. Same with just now what I say, right? DRR, responsiveness. So check for breathing, or actually maybe some victim will have breathing, but it's not a normal breathing, it's gasping. Yeah, gasping is like okay, definitely you know the gasping is not a normal breathing. This is considered no breathing too. Okay? And check for carotid pulse. Carotid pulse, you should check at the middle of the trachea, you slide towards the side of the trachea, then you will able to identify whether there's carotid pulse. Try to identify not more than 10 seconds, okay? Because we need to start CPR as fast as possible. So 10 seconds is enough for us to check already. Don't drag the time too long. Then, once you confirm it's a cardiac arrest case, you need to activate the emergency response. You need to call 999. Okay, after that, you need to go and get the AD. If you know where is the AD, you try to get the AD, okay? Then faster return back to the victim, okay? So return as fast as possible. Then, after that, start with high quality CPR, okay? Okay, so what are high quality CPR? Basically, high quality CPR need to be ensured to make sure that we provide good quality compression that can let the victim survive. Okay, so there are several criteria that we need to do during high quality CPR. Okay, first of all, you need to, let's say this is the adult victim, right? You need to place your palm of your dominant hand. You can be using your left hand or you can be using your right hand. Just put your palm of your hand, put over the lower part of your breastbone. The breastbone is around here to here. So it will be lower part of your breastbone. Okay? You put your dominant hand, lower part, another hand put on top of your dominant hand, then straighten your elbow, use your body weight, push your compression down. Understand? Okay, this is how we should do the compression. And the compression rate, we should give about 100 to 120 compression per minute. Okay? The speed is around like this. Okay? Alright? And how deep we should press? So we should press from minimum 5 cm, maximum 6 cm. Okay? Easier to remember, we should press deep as 5 to 6 cm. Right? We cannot press too deep and we cannot press too shallow. Why? If we press too deep, the heart will be severely compressed. Okay? And they cannot relieve to get the blood in again. Okay? If we press too shallow, of course we are not pressing the heart deep enough. The heart is not pumping manually by our compression. Okay? Next, after we press, right? After we press, we must allow the chest fully recoil. Yes, means we must allow the chest fully recoil. We cannot press deep only, never let the chest come back. Okay, so the heart is not pumping well enough. Okay, it's not pumping efficiently, right? And next, there must have minimum pauses between all the compressions. For example, if the AD arrive ready, you need to put your AD attached to the victim. You must do it as fast as possible. You cannot pause too long. If you pause too long, there's no active compression, no active blood and oxygen go to the brain, they will die. Okay, alright. And after we give compression, we need to give 2 rescue breaths to the victim. Okay, the 2 rescue breaths is to be given every 30 compression. For example, you press 30 times. After 30 times, give 2 compression, 2 breaths. 1, 2 to the victim. Okay, so this is 1 cycle of CPR. So again, the CPR ratio will be 30 compression and 2 breaths. Okay, and the ratio stay as the same for 1 person CPR and 2 person CPR. Alright. Also, if someone is coming to help you, the second person coming to help you to rescue the patient, your compression also 30 times. Your rescue breathing also 2 times. It's the same. Okay. So in 2-person CPR, if someone is helping you to do CPR, you can change position with the rescuer. For example, if you are the one who doing the compression, the second rescuer come and help you to give the briefing. Okay, you actually can change role with the second rescuer. For example, you want to switch to give the rescue briefing, and the second rescuer come and help you to do the compression. Okay, that should be changed at least every 2 minutes or after 5 cycles of CPR. Okay, can you change halfway before the 2 minutes finish? No, okay, better not. Okay, so now how to give effective brief to the victim? First of all, we have 2 manual here. We have the left one, head tilt chin lift, and we have another one, jaw thrust. Okay, head tilt chin lift is to be used in most of the case. Okay, if let's say we don't suspect victim having any trauma or any neck injury, okay, we can use head tilt chin lift. If we suspect in, for example, a car accident case, or the victim have trauma over the spine, the cervical spine, we don't want to hurt the cervical spine, then we use jaw thrust technique. Okay, so what are the difference? Head tilt chin lift means you open the airway. Okay, I will show you later, but why we need to give effective briefing? First of all, it's because we need to open the patient airway, and every rescue briefing we give up to 1 second. For example, we blow 1 second. Okay, so how long we should blow and how many times we should blow? So we blow every 6 seconds. Okay, every 6 seconds means 1 minute, 10 times of breathing we are giving to the victim. Right? So if there's no pulse, there is a pulse in the victim is not responsive, we check pulse, there's pulse, we check the breathing, no breathing, then no need to start CPR. Okay, because pulse is there, but the breathing is not there. We want to help with the breathing, so we can give the rescue breathing. So same, we give every briefing, give 1 second. Every 6 seconds, we give 1 briefing. So 1 minute, we give up to 10 rescue briefing. Okay, this is for adult. So okay, what is head tilt chin lift? How to do that? Let's see. Basically, 1 hand hold on the forehead, another 2 fingers hold the mandible and lift up. Okay, lift up. So by this, you're opening the airway. Okay, you're opening the airway. Then only you can give effective breathing to the victim. Okay, easy, right? Okay, next, jaw thrust. We only do this for those who had accident and we suspect spine injury because we don't want to disturb the spine. So how are you going to do it? So use your 2 fingers, hold the angle of the mandible, and another 2 thumbs hold the maxillar bone. Then push your mandible angle up. Okay, by pushing that, we are relieving the airway. Okay? We are not disturbing the spine. We just move the bone of the mandible up. Okay? Understand? Never mind, later we'll do practical session. So now, 2-person CPR. Just now I explained about 1 person, right? Now 2-person CPR. What we should do? Okay, so we have 2 rescuers here. So basically the first rescuer, you stand beside the victim side. The second rescuer, you stand beside the victim's head. Okay? The first rescuer is the one who's supposed to perform the chest compression. And the second one is the one who's supposed to manage the airway, give a rescue briefing, and open the airway. Okay? So first one, the first rescuer should do the high quality CPR, like what I mentioned just now. So you perform the compression at least 5 cm, maximum 6 cm. Okay? And the compression rate should be 100 to 120 per minute. And the compression to breathe ratio should be compression how many? Breathe 2, yes. And after compression, you should allow the chest to recoil back. And between the compression and breathing, the CPR, you need to minimize the interruption. Okay, even the AED arrive, you need to minimize the interruption. Then, when you do compression, you should count very loud, okay, so that everybody can hear you and everybody knows the progression. So the second rescuer need to open the airway. Okay, open the airway is either head tilt chin lift like this or jaw thrust. Okay, so to give 2 rescue breath. Okay, the 2 rescue breath need to be given within how many seconds? Blow how many seconds?
1 second.
Blow 1 second. Okay. Every how many seconds need to give 1 rescue briefing?
6.
Every 6 seconds give 1 rescue briefing. Means 1 minute how many breathe?
10.
10. Yes. Very good. All of you are good students. Okay, not only Dr. Gauri. Okay? Alright. So like what I say, you can switch between rescuer 1 and rescuer 2 responsibility or their role with every 5 cycles or after 2 minutes of CPR. Okay? Alright? So now, for child is a bit different. Okay? For 1 person, when you see a child collapse, same thing, you need to verify the scene safety. Then you need to check for responsiveness. You need to check whether got breathing or not or gasping or not. Then check for the carotid pulse and femoral pulse. Children, their size is small. Sometimes difficult to check from their carotid pulse. So if that is the case, check from the femoral pulse. Femoral pulse is within the inguinal area, right? You just find the pulse. This is femoral pulse. So check not more than how many seconds? 10 seconds. Very good. Okay. So after you check already, no breathing, no pulse, not responding, call the 999. Bring the AED. Okay. This is a bit different. Beware. If you're alone, you just stay with the victim. You provide 2 minutes of CPR first. Then only you call 999 or activate the response teams. This is a bit different from the adult. Okay. Because child usually they are very fragile. Okay, we need to start the CPR as soon as possible. Okay, so after that, only you start the high quality CPR. So if let's say the victim's heart rate is less than 60 seconds, I mean if there is pulse when you check the responsiveness, when there's pulse, but the pulse is very very slow. Okay, 1 minute is less than 60 seconds, and the pulse, the child looks very. The circulation is very bad. Okay, it's either the child is very blue, okay, with very poor perfusion. Then you also should start the CPR. Okay.
If you witness the
Collapse. Same. You need to give the CPR.
Yeah.
Yes. So same. The high quality CPR is more or less the same with adult. You need to put your heel of your hand, center of the chest, and the lower half of the breastbone. Imagine it's small child, okay? It's the same. Lower part of your breastbone, heel of your hand, put on the lower part of the breastbone, then start CPR. Okay? So, child, if the size of the child is very small, actually you can use only 1 hand to do the CPR. Don't need to put your another hand on top of that and do that. Okay? If the child size is very small, you can even just use your 1 hand, 1 palm to do the straighten your elbow and use your body weight to push down. Okay? Alright? So the compression rate is the same, 100 to 120 compression per minute. And the depth of the compression a bit different, okay? It's 5 cm, alright? Adult is
5 to 6.
5 to 6. Child, 5, okay? And same, allow the chest recoil after your compression and minimum pauses between your resuscitation and your compression. And the rescue breath is the same. Give 2 rescue breath and 30 compressions, okay? So high quality CPR, again, recall the CPR ratio for one person is 30 compression to 2 breath, okay? For 2 rescuer CPR, the ratio is different, okay? When 2 rescuers are here to help, the ratio need to cut down already. It's supposed to be 15 compression and 2 breath, okay? And in 2-person CPR, you should change the role of compression and rescue breathing after every 2 minutes, okay? But within these 2 minutes, let's say if you have 2 rescuers, 1 compression, 1 do the rescue breathing, how many cycles of CPR you are doing within 2 minutes? 10, correct? Yes, correct. So this is no longer to change after 5 cycles. This is to change your position after 10 cycles in 2-person child CPR, okay? Or infant CPR. So now, to give the rescue breath for the child, okay, it's the same, right? You need to open the airway by head tilt chin lift or jaw thrust, okay? It's the same technique with what we do with the adult, but the timing a bit different, okay? So every breath that you give also within 1 second, and then 1 second, okay? And you need to give every breath every 2 to 3 seconds, okay? Just now adult is how many seconds?
6.
Every 6 seconds, okay? But now child is you need to give rescue breath, repeat every 2 to 3 seconds, alright? 2 to 3 seconds means 1 minute. We give more breath already. We give 20 to 30 breath per minute. Why? What do you think?
Because the circulatory system is small.
Oh, yes, because after you collapse, right, your body still have blood. The blood still have oxygen. Okay. For adult, our body size is very big. Okay. We can last longer without breath. Okay, without rescue breath. But for child, their body size is very small, so their blood circulation is lesser in amount, okay? So the oxygen left in their body is lesser. So we need to give more breath to the child compared to adult, okay? So next, in 2-person CPR, more or less the same. You check the child for the response and breathing first. If no response, no breathing, and or gasping, then start the CPR, alright? So you check the pulse at least 5 seconds, but not more than 10 seconds, right? And try to check for carotid. If carotid, the neck very difficult, check for femoral pulse. That's correct. So if you don't feel a pulse within 10 seconds, would you check again?
No, start with second.
No, you should not drag, you should not check again. So you should straight start for CPR, okay? If there's pulse there, but the heart rate is less than 60 pulse per minute, would you start CPR? Or you check again? No, you should start CPR. Yes, correct. And less than 60 and sign of poor perfusion, you should start CPR, right? And when the second rescuer arrives, the compression rate should change from 32 to 52. Yes, correct. So use the AD as soon as possible. So now for infant CPR. It's the same. First, we need to verify the scene safety. Need to check for danger. Check for responsiveness. See whether there's breathing or abnormal breathing. Check whether there's pulse. For baby, the pulse, can you check at the neck? Cannot, right? Baby neck is basically don't have, right? So where should we check? We can check for the brachial artery. So brachial artery, you check from here. At your elbow, middle elbow, you come slightly to the medial side. Okay? Check for the brachial artery. Alright? So if no pulse, then send someone to get the AD. Alright? You should stay with the baby and you should start CPR first. If let's say you are alone, you should start CPR first before you go and activate the EMS and call for help. Alright? That's why I say baby, the size is very small. So they need to start as soon as possible. Don't go and get help and come back, right? So after you can start, just start the high quality CPR. So high quality CPR is the same, almost the same, but the gesture a bit different. Okay, let's say if this is the baby victim. So how are you going to do? First of all, okay, identify the breastbone. The breastbone of the baby is from here to here, alright? So you need to place two of your fingers at the lower half of your breastbone. Then it's supposed to be just below the nipple line, okay? Right? Then you do compression like this. Press down. Maybe it's easier because baby size is small, okay? So the compression, you just press. The compression rate is the same, 100 to 120 compression per minute, and the depth of the compression should be 4 cm, right? Should be 4 cm. And same, after compression, allow chest to recoil, okay? And minimize the pause between all your compressions. And lastly, provide the 2 rescue breaths to the baby for every 30 compression. Same, if you're alone, do 30 compression and 2 breaths. Alright? Okay. So same with the child. The ratio is 1% CPR is 30 to 2. 2% CPR is 50 compression to 2 breaths. And change after every 2 minutes. Okay, after 2 minutes, then only you call the response team, emergency response team. Right. The briefing, the effective briefing is a bit different from the adult and child. We only can use head, tail, chin lift. Why? Because we cannot do jaw thrust. Okay, maybe it's very small. Okay, so very unlikely they will have a spine injury or trauma. Okay, so we cannot do that. So we can only do head, tail, chin lift, right? So we also say with the child, we give rescue breathing every 2 to 3 seconds. So every breath you give within 1 second. Okay, this is same with the child. So for 2% is the same. You do the compression. Okay, there's another way of doing the compression. Just now I told you it's two finger lower breastbone press, right? There's another way if you are 2%. Okay, 2% means someone help you with the breathing. You can do the compression concentratedly. Okay, so how are you going to do? This is the baby, lower part of your breastbone. 2 times you hold like this, then press. You need to surround. You can surround your fingers and your thumb around the baby's chest. The 2 times put at the lower breastbone and press. This is during 2% CPR. Okay, all right. So the compression rate is the same, 100 to 120. And after each compression, allow chest recoil. And after every 15 compression for 2% CPR, give 2 rescue breaths. Okay. The second rescuer should give head, tail, chin lift and 2 rescue breaths. Okay, this is the same one for 2% CPR. Alright, the ratio is 15 to 2. Switch roles every 2 minutes of CPR. So, okay, now, after CPR, you have done CPR, someone bring you the AED machine, right? So you should know how to operate the AED. Okay, for AED, so there are common steps for starting all the AED. Okay, first of all, you need to, let me show you. You need to do the AED.
Inside the box.
So everybody know what is AED? Can you tell me what is the full name of AED? To see whether you're still awake. Sorry?
Right, external.
Automated.
Automated
Okay, A stands for?
Automated.
Yes, correct. E?
External.
External, yes, correct. Defibrillator. Okay, automated, external, defibrillator. One is enough. Thank you. Right? So, AED. So, it looks like this, okay? So, it looks like this, okay? So, in the market, most AED, they are simple. They have a machine. They have pads, okay? The pads are to attach to the victim. It can be adult pad and it can be child pad, alright? For adult, we use adult pad. Okay. For infant and child, we use child pad. Okay. So they have a on button, they have a shop button. Okay. On button is for us to open up the machine. Okay. When the AED arrives, the second rescuer bring you AED. The AED arrive. First of all, what you need to do is you need to on the AED. Okay. You don't on, you do, then the machine is not working. Okay. All right. So you have to on the AED.
Adult patient.
So
If
okay.
the patient is a child, press the child button.
Alright, so this is how you activate the voice prompt.
Replace.
Once you press the on button, there's a voice tell you what to do. Okay, this is what we want. Okay, alright. When you're in panic state, you don't know what to do. At least the voice can guide you what to do. Alright. So next, you need to attach the pad to the victim's chest. Okay. First of all, you need to choose the correct pad. Some AED in the market they come with two pads. They come with adult pads. They come with child pad. So you can choose. So for this one, very obviously it's an adult pad. You can see they print something that they print the adult image there, so you know this is adult pad, right? So after that, just want to tell you, we cannot use child pad to the victim 8 years old and above, alright? Because child pad is very small. The electric that they are delivering to the adult is definitely not enough, okay? But can we use the adult pad to child if we don't have other pad, we only have adult pad, can we use?
Yes.
Yes, we can use. Alright? So we have to plug in to the connector. Alright? So next, before we start the shock, after we attach, before we start the shock, we should clear the victim. Means surrounding the victim, no one's supposed to be near to the victim and no one's supposed to touch the victim. Okay? So be sure no one is touching the victim. The AED will tell you, will analyze the victim to see whether the shock is needed or not. Okay? So next, if let's say after analyze, the AED tell you, okay, this victim need to be shocked, shock advice. Then you will hear a prompt says shock advice. Right? So that means we need to press the shock button to deliver the shock. But before we press this button, we need to make sure that no one is in contact with the victim. No one's supposed to touch the victim. If not, you will kena electric shock. Okay, you will die on, you will collapse on the spot. Okay, so you should shout, "You clear, I clear, everybody clear." Okay, everybody clear. So after that, only you press the shock button. So okay, so as soon as you press the shock button, shock delivered to the victims. After the shock delivered, you should resume back your CPR as soon as possible. Okay? Should you wait for the, after you press the shock button, should you wait for the AED machine to tell you what to do first? No. Yes, don't. Yes? Really? Okay, don't wait, alright? After you press the shock button, shock delivered, don't wait for the AED machine to tell you what to do. You automatically, you know, you need to resume CPR. Okay? Alright? So CPR, we start with chest compression, not rescue breathing first. We start with chest compression. Okay, so adult, where you should put the pad. So let me show you. Okay, for adult, right? Sorry, baby. For adult, you should put there are two pads. Okay, the pad looks like this. So one of the pad you should put at below the right collarbone, at least 1 inch from, or if there's any medical device like the the pacemaker, something like that, you need to avoid. At least 1 inch away from that device. Okay? If there's nothing there, you just place right below the right collarbone. This is the collarbone, right? Right below the collarbone. Or actually, most of the AED in the market, the pad, they will show you where to place. You can see the picture, right? They show you where to place. You just put one below the right collarbone, another one below the lower left chest, somewhere below the nipple line, easier for you to remember. Okay, so this is how you should place the pads. Okay, before you start the shock. Alright. So this is for adult. For baby. Okay, depend on the size of the baby. depend on the size of the child, sorry. For the child, depend on the size of the child. If the child is a big size child, it's the same. You put here and you put here. Okay, right below the collarbone and left below nipple line. Okay? For baby, like this, for child, like the very small size child or baby, okay, where you should put, one you should put at the front, center chest, another one at the back, right? Between the two scapula, right? At the back. So, small size child or baby, you should put one pad at the front, one pad at the back. So most pads in the market, they will show you the picture. If you're not sure what to do, you just follow the picture. The picture show you where to put. Alright? Okay? Okay. So this is child and infant. Center of chest, back, front and back. Okay, so now let's start with the exciting session, which is practical session. Okay? Alright. So now I give a case scenario. I will ask one of you to come up and show me what to do. Okay? Before that, let me clear this area for you first. So Prof. Kumar looks very tiring. In order to help you to regain his consciousness, in order to help you to regain your consciousness, please come up. Okay, please come up. So, I have a victim for you. Okay, we have two case scenario. Let's start with the first case scenario for Prof. Kumar. Give him. Okay, now. So I tell you what happened. Okay, so this is the case. Okay, it's Sunday. Okay, it's after Sergey's open day. All right. After a long day of Sergey's open day, finally you got time to go home now, right? So you walk towards the MRT station, right? When you walk towards the MRT station, you pass through one garden, okay? There's no garden, you just imagine there's a garden there, okay? So when you pass through the garden, you saw an old uncle there do this. So let's see what he did. Let's see what he did. So he hold his chest, looks very suffering, and he fall to the ground. Like this. This is the uncle, hold like this, suddenly, pop. Okay? So now, imagine, the uncle is lying on the ground. What are you going to do?
I will rush fast.
Okay.
I will see any dangers nearby. Okay, then I'm going to call uncle. Correct, right?
When you do first, I will correct you later. Do first. Okay?
Then I'll check for the pulse, carotid pulse.
Okay. Then pick up. Okay.
I check for breathing.
Okay. Check
Okay,
breathing.
so no response. So
Okay.
I am going to do CPR.
Okay. How are you going to do the CPR?
I will call for emergency. I mean, I have to call for someone who is there to help me.
Okay. You're asking someone around you to help you. See, so many people around. Are you asking?
Gauri, can you come and help me? Please come.
Sure.
Please do.
Also, Dr. Gauri happened to pass through the garden also, right?
Yeah.
Walking to the MRT,
Yeah.
so you saw
So
Dr. Gauri.
I saw her.
Okay.
Please come to help me.
Okay.
Now you start.
You're supposed to tell me to call.
Okay. Then what are you going to ask Dr. Gauri to do?
Please call for emergency. I need someone to come and help me now. So please call.
Okay, now you already asked someone around the scene to help you to activate the EMR, means call 999. Okay? Okay, now what are you going to do?
I'll start with CPR.
Okay, you're going to start with CPR.
So
How are you going to do?
one hand below
Okay.
the breastbone, sternum, another hand here,
Alright.
and then
Straighten your elbow.
straighten the elbow.
Okay,
And I
then?
have to give the compressions, 100 to 120 compressions within a minute.
Okay.
Between 30 compression, I have to give 2 breaths.
Okay, now can you start your compression? Count loud.
Sorry.
Need to count, ah? Count.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20,
Very good.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, good. After 30 compression, what are you going to do?
Head till chin up, then 2 breaths.
Give breath how many seconds?
1 second per breath.
Okay.
Yeah.
Yes,
so
correct.
2 breaths I'll
Give
give.
every how many seconds? Repeat the breathing every how many seconds? 3 seconds or 6 seconds?
6 seconds. 6
Yes,
seconds.
correct. Repeat the breathing every 6
Every
seconds.
6 seconds.
Okay. Alright, but that is rescue breathing.
Yeah.
Does that apply to your situation now?
No,
No, right?
No.
No, right?
So 30
After the compression,
2
straight away
breath.
give
2 breath.
1 breath.
2 breath.
Okay.
Yeah.
Then continue with your compression.
CPR.
Okay. Now you're doing 1 cycle of CPR, you finish 1 cycle already. Then suddenly Dr. Gauri came back. He very smart.
I didn't ask AED, so I came without AED.
Okay, she very smart. Okay, you never ask her to bring AED, but she helped you to fly from Thompson Hospital. AED machine. Okay, she come with AED machine. She asked you what she can do. Okay, what are you going to ask her to do?
You know better than me, so can you please
Okay, please assign her role. What she should
Okay,
do.
so you be on the. I mean.
Come here.
Okay.
Wait, I drink to the. Okay, go.
So we will place the.
So you do this one, so I have to place this, right?
Yeah,
Okay,
I-
you are
I-
the one who doing CPR,
Yeah,
right?
yeah, I'm doing CPR.
So she's the one who need to take care of the airway and do other things,
Yes,
right?
yes.
Now, when you're doing CPR,
She is placing.
The
so
AED.
simultaneously I'll be doing it.
okay, are you going to stop the compression?
no,
For
no.
her to put the pad, are you going to stop the compression?
No, I
No.
will ask her to do it by the side and I'll just.
Okay, and you
not do it.
continue with your
Adult
compression.
patient.
And she
If
helped you
the
to on the
patient is a
AED
child,
already?
Yes.
Press the child button. Do not touch the patient. Analyzing heart.
I clear, you clear.
No, not yet. Analyzing. Okay. No, need to clear for the analyzer. So, no battery? Okay, never mind. So let's say analyze already. Okay, the AD machine say shock advice. Deliver the shock. What are you going to do?
I clear, you clear, everyone clear.
Who clear?
I clear, you clear, everyone
Clear
clear.
means what? Clear means what?
Clear from the
Place.
Don't
Go
touch
away.
the-
Don't touch the
don't
patient.
Water observation. Oh, okay, understand. Now I clear, you clear, everybody clear. So the AD say shock advice. Press the shock button, then you press the shock button. Okay? So after shock button delivered, what are you going to do?
Continue CPR.
Okay,
One,
so while you're
two,
doing the second round, okay, continue. Count.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16. It's speaking there.
Help the patient fast, help.
25, 30. Okay.
Then you give two, breathe. Yes, correct.
Okay,
So,
correct.
okay, you're going
Yeah,
to do how
correct.
many rounds?
5.
5.
My first two must finish the top.
Not now, lah, later practical.
Yo.
Okay, so you're going to do 5 rounds or how many minutes?
2 minutes.
2 minutes, yeah.
Let's say you do 2 minutes already.
After that exchange.
You feel
come
tired already,
here.
you exchange with.
Already I'm tired.
Gauri?
So this one we don't remove, right?
No remove.
Then when they say next,
Okay, usually the AED machine, after they can sense how many rounds you're doing, they can sense how many compression you're doing. Usually after 5 rounds, 5 cycles, they will say they want to analyze. They will ask you to stop CPR.
No, stop.
They will shout stop CPR. Then you stop. You clear, I clear. Everybody let the AED machine analyze. Then they will tell you shock advice, then shock, continue CPR. Okay? So very smart. The AD and the machine are very smart. Okay? You just follow the instructions. But don't don't wait for the instruction after shock. You should straight away resume CPR. Alright? Okay, very good. Excellent student. Excellent student. Okay. Okay, this one I'll put back first. Where is the this thing? Thank you. Okay. Never just put somewhere. Wow. Somewhere. Okay, so now first scenario done already. Okay, Prof Kumar passed with flying marks. Okay. So now let's see another case scenario. Oops. Okay, so this one is for Shafia. Please come up. Alright, this is another case scenario. It's for you, it's a baby. Okay. So alright. So Shafia, okay, you're going to your friend's house to visit your friend. Okay. After you go into your friend's house, suddenly you heard your friend shouting and crying. So you went over and you saw this. Okay, let's see what happened. So basically, she's shouting and crying in front of the baby. She said the baby is not responding at all. Okay, she said the baby no response. She don't know what to do. Okay, just nice you are here. Okay, you know how to do BLS, you know how to do basic life support. Now you're ready to help. Okay, come. What are you going to do now?
Okay, I go to the baby. I observe around because we don't know why this baby is not respond. Either choking or maybe it's a new what we don't know. So just try to wake up the baby.
Try to check for
response.
Okay, how to check for response?
And just tap the baby.
Tap the baby. Alright, where to tap the baby?
At the shoulder.
For baby, more better we tap at the sole. Okay, so the sole of the baby. You should tap the sole vigorously. Baby, are you okay? Are you okay? Like this. Okay. So because baby's sole is more sensitive compared to other parts of the body, right? Okay. Now do it.
Baby, are you okay? Are you okay?
The baby saying not okay.
No response.
Okay. Then
So
check
I check for the brachial pulse, and then no pulse.
okay, no pulse.
No pulse. So I check surrounding. There is no sign of choking.
Okay.
Then I
Check for
the chest rise.
Chest rise to see whether the baby
breathing or not.
breathing or not. Okay.
No breathing.
No breathing. So no response,
No response.
no pulse, no
breathing.
breathing. So okay, we should treat this baby like cardiac arrest case.
Yes.
So now in baby cardiac arrest case, how are you going to do?
I start CPR with 2
Fingers
fingers
placing on
placing on sternum,
sternum,
and then
upper part of the sternum or lower part.
lower back.
Okay.
Okay, lower back, and then I let you press 1, 32.
Okay. So what are the high quality CPR in infant?
What is when
Now you're doing CPR on infant, right?
15.
You want to make sure you have high quality CPR, right? In high quality CPR infant, what are you going to do? What you need to do?
I do the CPR 15 compression
Okay.
to breathing.
Okay. Okay. So 15 to 2 means it's a one-man CPR or two-man CPR.
One man.
It's a one-man CPR. Okay.
Oh,
Okay. Let's say your friend cried, and she went out already. Okay.
Okay.
I don't know what the friend do, but the friend maybe trying to get some help from outside. Okay. So the friend went out already. Okay.
So I need to do
Try to
30.
call the ambulance now. Okay. So now you're alone. Okay.
I do the 30.
You're doing one-man CPR.
one man CPR. So
Okay.
30 compression to breathing.
Yes. One-man CPR, 30 compression, 2 breathing. If two-man CPR,
15 compression to breathing.
very good. Okay. Now start with your one-man CPR.
Yeah. 1,
3, 4, 5,
6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9,
20.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
30. Okay. After 30 compression, give
Then 2 blow.
2 breathing. Yes. So do it. What are you doing? What maneuver is this?
Head tilt chin lift.
Very good.
Okay, so 2 blow. Then I start again with the CPR.
Okay, the blow in rescue breathing, not in this case. In rescue breathing for infant, you give blow every how many seconds to infant?
5 or 2 to 3 seconds.
Yes, in rescue breathing for infant, you give breath every 2 to 3 seconds. Okay? Alright? Okay, then now continue. So now, after you do 1 round of CPR, okay, your friend already called ambulance, and the neighbor
If they
actually know what is happening already. The neighbor come and help. Okay, the neighbor is Dr. Lee. Alright?
Okay.
The neighbor is Dr. Lee. Dr. Lee rush and say, okay, what's happening? Do you need my help?
Yes.
I also bring AED.
Dr. Gauri and Dr.
I also bring AED. My house got AED. I think something is happening. I bring AED in now. What should I help now? How can I help
can
you?
place the AED.
Alright.
Okay.
Okay. Okay.
Place the AED. So,
I know how to put AED. I know in a child I should put at the front and the back. Okay, correct? Correct?
correct.
Okay. Front
And back.
and the back. Okay, I put already. Now what should I do?
On
On the AED.
AED. Okay. Then
Adult patient. If the patient is a child,
Press stop.
replace batteries.
Okay, imagine it's working. Imagine it's working, okay? I'm on already.
okay. So while this machine would want to do the analyze, so
Correct.
we have to clear the situation.
Okay, clear the
Cannot
patient.
touch the baby.
Okay.
So let it analyze.
Okay. So now AED say no shock advice.
No show advice. Then I continue the CPR.
Okay, how are you going to do the CPR now?
I just do with the lid there.
I know how to do basic life support. I can help you. What
so
should I
I
do?
do the 15-2, so we can change.
Okay, now 52. How are you going to do on the baby the compression? Are you going to do this or you want to do the two thumb technique?
I'm going to do this.
Do this. Okay, no wrong. Actually,
There's no wrong.
there's no wrong. She can do that. But
She
more
was expecting to say.
but more effective way in two-man CPR will be doing like this. Okay, the so-called encircling technique. Encircling technique. You circle your hand, okay, around the chest, around the chest. Then the two thumbs put at the upper breastbone or lower breastbone.
Lower.
Lower breastbone and press like this. Okay, so now let's try the two thumb encircling technique. Okay, so
Okay.
you put the baby here so that I can help you roll. Okay, all right. Now what should? Okay. So now you want to start continue CPR, right?
Yeah.
Okay, come. Baby is heavy. No. You just make
There.
like this. Yeah,
Oh.
like this more comfortable. The baby is heavy actually. Okay, then start your CPR. Start. 1, 4,
5,
sharp.
7, 8, 9, 10. 1, 2, 3, 4, 5.
Okay, 15 already, right? Then I give rescue breath. Head, tail, chin lift. Jaw thrust or not?
No.
Can I do jaw thrust?
No.
No. Okay, head, tail, chin lift. 1 breath. Observe chest rise. Yes. Second breath. Observe chest rise. Yes, chest rise. Okay, so 2 effective breathing given. Then continue. Okay.
Then 1, 2, 3, 4, 5.
Okay. 1 rescue breathing. 2 rescue breathing. Okay. So we change role after how many minutes? If let's say you're tired already, I can continue CPR and you continue with the breathing. We change role after how many minutes again?
2 minutes.
2 minutes. How many cycles?
1 cycle.
No.
10 cycle.
1 cycle is 15 compression and 2 breath. How many times of 15 compression and 2 breath? How many cycles we should change row?
10.
10 cycles, correct. Okay? Because 2-person CPR, the ratio is 15 compression, 2 breath. Means we need to do 10 cycle of CPR already. It's not like adult 5 cycle, it's 10 cycles. Correct? Okay, give a round of applause to the teacher. Thank you. You are lucky. The neighbor is Dr. Lee.
Dr. Lee and Dr. Gauri came with AED.
We are smart. We come with AED without you asking us to do. Okay, alright. Okay, so that's the end of our practical session. Okay, thank you so much. So we shall rest for a while. So now let's start with our last part of the session, which is how to relieve choking in choking victims, right? So first of all, for adult and child, we have conscious choking victims and unconscious after choking victims, right? So now with adult and child, conscious choking victim, what we should do? Right? First of all, we should recognize whether they are choking or not. So how are we going to recognize whether they are choking? So there are two. Okay, choking basically means something is stuck at the airway. So we call this airway obstruction. There are mild airway obstruction and severe airway obstruction. Mild means how to see. Okay, mild means you still got airway exchange. Means somehow still can breathe. Okay, and you can cough. You can cough forcefully, and with the cough, you might listen there are some wheezing, for example, something like that. But somehow you still have good airway exchange, so this is called mild, right? And of course, the victim is conscious, right? Now, severe airway obstruction is a bit different, okay? First of all, you have poor airway exchange or definitely no airway exchange. Means sometimes you can barely hear the breathing, maybe like something like that, okay? This is definitely very bad, okay? And they have very weak cough or ineffective cough, means they cannot cough very forcefully, okay? And they have high pitch voice during inhale, for example, or no noise at all, okay? And they have increased respiratory difficulties. You can see they barely breathe, okay? And they possible have cyanosis already. Cyanosis basically means don't have oxygen in your body, so you turn blue. And if for child case, maybe they are unable to speak or cry, cannot speak. Infant also, okay? But that one is later. I will teach you later. So most of the time, they will clench their throat with the so-called universal choking sign. Okay, they will clench their throat. They are trying to remove the airway obstruction out. So they will do something like this, and they will try to cough. This is so-called universal choking sign. Okay, so mild airway obstruction still manageable. Right? Severe airway obstruction, we need to step up our action. Okay, so now what we should do in mild airway? So in mild airway, as long as there are good air exchange going on, just ask the victim to continue to cough. Just encourage them to continue to cough. Don't try to disturb them, okay? Because they are trying to attempt to cough out the foreign body, okay? So next, do not interfere with the victim's own attempt to relieve the obstruction. Stay with the victim and monitor his or her condition. And if the mild airway obstruction persists, means after they try so hard, the obstruction is still there, right? Or when they progress to severe airway obstruction, means from mild progress to severe, then activate the emergency response system, call 999. Okay. So persist means persist how long? What do you think? For example, you choke with fishball, right? You can breathe yourself if you have good airway exchange. You try to cough out. How long I should try? You are standing beside me, you want to monitor my condition. do you think how long I should try before you try to call the 999? 1 minute?
Oh, 10 to 20 seconds.
10 to 20 seconds? I have good A exchange, I'm good, I'm conscious.
Until you become unconscious.
You ask me, are you okay, Dr. Lee? I said, like that, okay? How long I should try to, but fail, how long I should try?
5 minutes.
9 minutes, a bit too long. Okay,
No
2
signs
minutes.
of severe airway obstruction.
Okay, if I try 50 minutes, okay, just give you a time frame, okay? It's not stated in AHA guideline. This is just my experience, okay? If they try like up to 50 minutes, still very hard to cough out the foreign object, then you should send the victim to the emergency already, because emergency they have ENT team, they can do something to take out the foreign object, okay? Alright? So if let's say I try so long already until I fainted, okay? I fainted already, then I became severe airway obstruction, I become unresponsive already, okay? So I should start CPR, alright? Okay, this is from mild airway to severe airway, I become unresponsive, you should start CPR already, okay? If let's say the victim starting is already severe airway obstruction, what are you going to do, okay? You are going to ask the victim if he or she is choking, for example. Mr. Bean. Okay, Mr. Bean. Okay. Sorry, I'm making you restless. So, Mr. Bean eating fishbowl. Okay, he was choking. He got sign of severe airway obstruction. I can barely listen her breathing, and he looks blue already. Okay, so he was coughing like that. Okay, so what am I going to do? First of all, I need to ask him or her, ask Mr. Bean whether he's choking or not. So I'm going to do like this. Mr. Bean, how are you? Are you choking? Then Mr. Bean will be like this. Yes, I'm choking. Okay, alright. Then after that, if the victim not yes, but cannot talk, then the severe airway obstruction is there. Okay. Then we must try to relieve the obstruction. So, how to relieve the obstruction? I will talk later. Okay. So now, to relieve the obstruction, we need to do abdominal thrust. So this is for children case and adult case. Infant will be later. Alright? So let's say Mr. Bean is an adult. Okay, Mr. Bean have severe airway obstruction already. I know I need to step up to help him to relieve the choking. So I need to do abdominal thrust. Okay? So first of all, I need to stand or kneel behind Mr. Bean. Okay? So I need to do something like this. This is Mr. Bean. I need to stand and kneel behind Mr. Bean. Okay? No need lah, you just that. Never mind. Okay? Then, next, after I kneel behind Mr. Bean, next I need to wrap my arms around Mr. Bean's waist. Okay? So next step, with one hand, I need to make a fist. Okay? Make a fist, then I put my fist against the Mr. Bean's abdomen. Alright? So I need to, where I should put, it should be below the breastbone. The breastbone is here, right? Below the breastbone and above the navel. Alright, so it has to be below the breastbone, above the navel. Okay? So I need to grasp my fist, okay, like this. So the palm side is putting over the abdomen side. So other side just face outside. The thumb facing inside. Alright? Then after that, put my another hand, press my fist, then push in, upward and fast. Like this. Okay? Understand? Can Alright. So when you do this, right, try not to squeeze the rib cage. Because once you squeeze the rib cage, you are not doing efficient abdominal thrust. Okay? Understand? Okay. So repeat the thrust. Repeat this. Okay? Until when? Until when? Until the object expel out. Okay? Alright? Or until the victim collapse. Okay? Means from the mild airway obstruction became severe airway obstruction. Then are you continuing to do that?
No.
No, right? You need to put the victim down and start your CPR if the victim became unconscious. Okay? So this is how you should do. Kneel behind the victim. Okay? Wrap your hands around the waist. Hold your fist. The thumb side put towards the abdomen. Another hand hold, then push inwards and upwards. Okay? So if let's say in pregnant lady or obese victim, their abdomen is big, right? You are definitely not going to press the obese abdomen, right? So you can do chest thrust instead. So the chest thrust is the same. The breastbone, the lower part of the breastbone, you go down, do like this. Okay? Right? So yeah, again, if pregnant or obese, do chest thrust, not the abdomen thrust. So, okay, that is conscious victim. How about unconscious choking victim? What we should do? Unconscious means they already collapsed, right? Okay. So first of all, you do something like you do DRCAB. But danger, you know okay, you witness okay, you know the danger. Respond, shout for help. Then if another person is available, you ask them to call the 999. Alright? Then you begin CPR. So start with your compression. You don't start with breathing first. You know it's choking, but you don't start with breathing first. You start with the compression first. So do not check for pulse because you know obviously this person is choking. So each time after you do the compression 30 times, right? You're going to open up the airway, head tilt, chin lift, and do the breathing, right? But this time a bit different. When you open head tilt, chin lift, you open the mouth and see whether there's anything inside the mouth. Okay? So when you see any object inside the mouth, remove it. So if you don't see anything, you just give the 2 breaths. Okay? Then continue your CPR. Okay? If you don't see anything, don't try to blindly swipe something out from the mouth. Okay? Alright? So now, how to take up the object? Dr. Gauri, best student, can you tell me what to do? Don't tell her. Yes? Finger. Which finger? This finger. This middle finger? This ring finger? Or use the thumb? Or like this? Hand go in?
This one.
Okay. So my suggestion, it's not stated in the AHA guideline, but my suggestion, for adult patient, you can try to use your index finger. Okay, your index finger is quite long. You can go in, make a C shape, scoop out the foreign object. Okay. If baby mouth, of course your baby this small, right? Of course your index finger is not sticking in, right? Try to use your smallest finger. Okay, right? Okay, so after your 5 cycle of CPR and 2 breaths, okay, or after 2 minutes of your CPR, call the EMS, okay? Call the 999. If never called before, alright? Because you see, from first you witness the unconscious victim, right? The first thing you do also shout for help. Noted? It's the same with the cardiac arrest victim. The first thing that we do for adult patient, okay, is shout for help. So if a choking victim is already unresponsive when you arrive, and you probably do not know that the victim has foreign body area obstruction exists, you should activate the EMS and start CPR first. It's the same thing, okay? If you don't know whether that victim is choking or not, you just arrive, you don't know what happened before, we do the same, the DRCAB, okay? So now in infant, which is responsive, okay? What we should do, how we should recognize. So for infant, also say we have mild airway obstruction and severe airway obstruction. So for mild airway obstruction, say good airway exchange can cause forcefully, a squeeze between cough, because babies also can cough like that, right? So for severe airway obstruction, it's the same, no exchange or poor air exchange, weak or ineffective cough, high-pitched voice during the inhale, increased respiratory difficulties, turn blue, cyanosis, not enough oxygen, and unable to speak or cry. Okay? The one thing that baby cannot do is which one? Compared to the adult. Baby cannot do this. Okay? Baby cannot do the universal sign of choking. The others all is the same. Alright? So how we should do for a mild airway obstruction? For mild airway obstruction, same. We do not interfere with the infant's own attempt to cough out things. Alright? We should stay with the baby and monitor the condition. And if the mild airway obstruction persists, then we should call the 999 already. Okay, we should send the baby to emergency. Then the doctor will help the baby to expel the foreign object out. Okay, if it's a severe airway obstruction, the baby cannot make any sound or breathing, then we must try to help the baby to bring out the obstruction, to relieve the obstruction. Okay, what we should do. Also same for children and children and adult. So sorry. This one. Okay, sorry. Just keep that. Okay, so this is the one. If infant had severe airway obstruction, what we should do? We should perform back blow and chest thrust. Okay. So Mr. Bean should rest first. Let's bring baby Bean. Okay. All right. So we should perform back blow and chest thrust. Okay. So what we should do first of all. We should we should check for responsiveness. Okay, let's say the baby became unconscious already. Okay, no, this is conscious baby, sorry. So same, we should bring the baby, hold the baby up, alright? Hold the baby up with your hand wrapping the head of the baby, and for the baby whole body lying on top of your upper arms, alright? Then we should find somewhere to sit. If you cannot sit, at least you kneel down. Okay? When you kneel down, you're resting your baby on your thigh. Okay? So imagine I resting the baby on my thigh. Okay? I just want to show you. I don't want to put so low. Alright? So now what you're going to do is you're going to perform the baby's head need to be slightly down a bit. Okay? Lower than the chest. Okay? So now you're going to do the chest thrust. Okay, so how are you going to do? Sorry. We do the back blow, sorry. So we turn like this. We do the back blow first. So we're going to use our palm to hit between the two shoulder blades. Okay, between the baby's two shoulder blades like this. 1, 2, 3, 4, 5. Okay, after that we hold the baby's head, turn over. Then this time, we need to open up the mouth and see whether there's any foreign object. If no, then continue chest thrust. Chest thrust, same, 2 fingers on the lower half of the breastbone. Press like CPR, press 5 times. 1, 2, 3, 4, 5. Okay? After that, change back. Still no relief, change back. Okay, 1, 2, 3, 4, 5. Okay? If no, come back again, check. If don't have, again chest thrust. We do until when?
Out.
Until the foreign object is out.
How long we can continue doing it?
Okay, if we continue very long already, still not coming out, then we send baby to the emergency. Okay? Like the adult is the same. Okay?
15 minutes like
Yes. Okay, if let's say the baby, after we do so many chest thrust, back blow, chest thrust, back blow, okay, suddenly you noted that the baby is not responsive at all. Okay, you faster put the baby on a flat surface. So the baby, you confirm already, became unconscious. Okay, due to respiratory failure. Okay, because no oxygen. Baby fainted and you do everything same with the DRCIB. Danger you know already. Response. Now check for response. Response check from where? Shafia. Like this?
so long.
The sole of the feet. Just hit harder on the sole of the feet. See whether baby is responding. Same. Check with the pulse. Where to check the pulse? Check here. Check brachial. Okay. To see
check the
pulse.
pulse in choking?
Sorry?
Because this is a choking case, right?
Oh yeah, sorry.
So no need to check.
Actually,
But the child went for unresponsiveness. right?
unresponsive already.
So,
Why you check that? Okay.
no, yeah, the child is now unresponsive, right? There is nothing wrong in checking for.
Nothing wrong, yeah.
Nothing wrong in checking the pulse. No problem. Okay. So chest rise, same thing. No chest rise. Okay. Actually, you are right. In how to say in witness case, we know this is due to choking. All right. So we should start. If we confirm no response already, we should start CPR fast. But if some case, the baby choking before we come, we don't know what is happening. We don't know what happened before. We don't know the choking took place before. So we start with DRCAB. It's the same. Okay? Alright? So shout for help. Ask someone to activate the EMS, means call ambulance. And place the baby on a firm and flat surface like this. And after that, begin the CPR. Okay? Starting with compression. Do not check for the pulse. When this is a witness case. Okay? When this is a witness case. Then each time you open the airway, when we do the compression, one person is how many compression? 30 compression and 2 breath, right? Okay, when after you do the 30 compression, you want to open the airway head till chin lift to check for the to do breathing, right? That time open out the mouth and check whether there's foreign object. Okay? Open to see whether you can see any object. If you see that, remove it. Okay? In baby, very small mouth, we try to use the smallest finger as possible. Okay? Then if you do not see the object, just give the breath. Okay? And continue CPR. Don't do blind finger sweep. What happens if you do blind finger sweep? What do you think, Shafia?
We might push the object.
Yes, you might push the object further in. Okay? Alright? So after 5 cycles or 2 minutes of CPR, okay, activate the EMS, means call the ambulance. Right? So okay, now you all know what to do already, for conscious, unconscious, adult, child, infant. Okay, so I assume you know what to do during the practical session. So now comes the most exciting part, okay, of the lecture. So let's see this now. We have 2 cases here, case scenario 1 and case scenario 2. Okay, so let's see. Okay, who do I choose? I think Dr. Wilson. Just nice, you're back here, okay? I put baby beat back first. Okay. Okay. So now what happened is you are going to be seeing your friend. Okay? So your friend is patiently waiting for you at home. Okay? So when you knock the door and come in, you suddenly saw this. Okay, this is what happened.
Your friend is that.
My friends are so your friend is got bad airway exchange and looks very uncomfortable and fall down. Okay? Like this. Okay? So now what are you going to do?
Uncle, are you joking?
Yes! Yes! Choking! Okay, now what are you going to do?
Okay.
Uh-huh.
Okay.
No, he is responding.
He do like this. He do like this, then he is like that.
Okay, then.
What are you going to do now?
Okay, so now I'm going to do abdominal thrust.
Why?
Let him first.
Why?
You see, there's no good action, right?
No, he is responding.
He is responding. He is responding. He do like this.
Okay, cough, cough, cough.
Are you going to shake Mr. Bean?
Please continue coughing.
Okay. First of all, okay. This is mild obstruction or severe obstruction? Why mild obstruction? What are the signs of mild obstruction?
There is good airway. There is airway exchange.
Okay.
There is cough. He's trying to cough.
Okay.
And then he's responding.
He is responding. Yes. And yeah. Okay. So these are the signs of mild obstruction. Means he is responding. This is the most important part. Okay. So in this case, what you need to do?
Encourage the patient to continue to cough.
Are you going to hit like that?
Please cough.
Encourage.
Okay, you are going to stand beside the victim. Ask him to cough. Are you going to do something like this? Right?
No,
Go.
no, no.
No, okay, so don't interfere with the victim's attempt to remove the foreign object. Okay? So he said, okay, like that. Okay? So suddenly he wheezing very bad, turn blue already. Okay, you see, wow, the face, the lips all turn blue already. He was like, no airway exchange. You barely hear the breathing sound. Now, what are you going to do, Mr. Bean?
Okay, so asking, okay, I need to ask him. I need to ask him.
Ask him to see whether he can nod or not.
Uncle, are you choking?
No response.
Like that. Like that.
Okay, so then I'll do abdominal thrust.
Okay, so are you going to tell Mr. Bean what are you going to do? Yes, you should. Okay, you should.
An abdominal.
Because Mr. Bean might got anxious, okay, got panic attack. So you need to let him know that you're going to help him. Okay, you can tell something short like, okay, I'm going to help you to relieve the choking, okay, like that. You can just
I'm going to help you to relieve choking,
Okay, okay, like that. Okay. Now what are you going to do?
So now,
You're pressing Mr. Bean's chest. Yeah, is Mr. Bean obese? He looks very fit, right? Okay.
Little bit down.
Down.
Still, you are pressing your chest.
You're right.
Okay, first of all, you are going to do abdominal thrust, right? So, okay, first step. Let's start with first step. What are you going to do now? With your hand,
So I'm going to make it into a fist.
make it in the face. Put between
between the
breastbone
breastbone
and the
navel.
navel. Between there. Yes, correct. Then another hand.
on top.
Alright. Then
And then
do abdominal thrust. Upwards and fast and forcefully.
how come I can't?
This one you can't do it as
And you can see you peluk tak.
Okay,
Memang tak boleh.
It's okay.
You will break
Just
it.
imagine.
Patung.
Just imagine you're doing it right, okay? So you're going to put under the breastbone and below the navel. So you make your fist, the thumb side towards the patient's abdomen, okay? Another hand, wrap around and upward and forceful position like this. Okay? Something like that. Okay? If you want, I can give you the active fast. With the act fast.
Act fast.
You don't have the tummy to do it.
Wait, ah.
Then.
Okay.
Oh. Okay. Okay, Shafia. Be the victim now. This is difficult because this is not the actual choking mannequin.
Yes. That's
Okay?
right.
So Shafia, put this for me now.
Kan ini kita sendiri pakai.
Oh, no, not for you, not for yourself. It's for victim of you. So what are you going to do for this? Okay. This. Okay. 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 Let's check the order. So put this in. This one, advanced student. You are advanced student, right?
Very advanced. Okay. You can put
You
money
are
also
what? You
in-
started acting.
Okay. Alright. So now, Shafia is the victim. So continue your
Saya press
abdominal
this
thrust.
one here.
Yes. Now
Here,
what
this
should
one here.
Yes, yes. Now what you should do? You should stand and kneel behind the patient. So ask her to open her leg. Please open her leg. Yes. Then you kneel between the legs. Then your hand wrap around the waist. Then put your dominant hand, the face, the thumb towards the abdomen. Another one, grab the top. Very good. You're doing it right. Now do the abdominal thrust. sorry. I think I should do it for the beginning. Let's use the.
Dia nak keluar.
So sorry. Okay, my bad. I use the beginning one, huh?
Take out.
So sorry.
Okay.
So try the beginning one. Okay, if you do it right, it should come out. Okay?
Sure.
Now, let's try the second round.
I can't see you. Sikit tu doktor.
Pause. Pause. Yes.
No.
No, you should do it forcefully.
Hampir.
No, you should do it fast and forcefully. Okay? You cannot do it slow like that.
Doktor
Alright?
like this. This hand push your this hand.
Okay, foreign object fly out already. So this is
Wow, I can breathe now.
so this is how you're supposed to do. Okay? One last try.
Yeah, we'll try.
Okay. You just now. What is your problem now? Is you're slow. Like that.
Fast.
You should shoot like that. Fast. Okay. Maybe you kneel down a bit long.
Okay.
This is beginner to huh? Next one I should use the advanced.
Correct, that's right.
Yeah.
Little more. Do it fast. You're doing
It is so hard. It's so hard.
Not hard. Just now mine fly out already.
I can't even press until the
Okay,
end.
so what is your problem now? Is you are slow actually. How fast should be fast? You should be like that. Okay? Okay, let's.
I also cannot. Masuk dalam?
Let's try. One last try. Okay? No, you higher speed. Okay. Oh no, so you go straight. You high speed. Okay? Oh. Almost old. Okay, never mind. So you got the idea?
Oh God.
You got the idea? Yeah. Okay lah.
Jahat ini.
Thank you so much, Safia.
Thank you so much.
Okay, so the idea is to be fast. Okay, the idea is to fast and hard, forcefully, upwards, abdominal thrust. Okay, can? So next time you should, this thing should come out, the advanced one.
I need to practice.
Okay, so you got the idea already, yeah? Okay, so this is how we do. Okay, so next case scenario. Oh, yes. So next case scenario. Okay. All right. So Shafia, rest first there. So Kuma, this is your case.
Okay.
Oh no, it's a
Infant. Should be
No, it's a
child.
yeah. Okay.
Almost the same thing.
you can use the same anything.
Oh, never mind. This infant.
Okay. I'll go at this time.
Okay, so one day you're going to your colleague's house. Okay. After the study opening again, right? So you went to your colleague's house. Your colleague actually inviting you to come to the house to eat curry. Okay. Then halfway cooking curry, she said she got no salt. Okay. And she said, okay, I will leave my 1-year-old child, 1-year-old baby with you. You please look after my baby, okay? So I'm going to buy salt,
Okay.
okay? So you're alone here with my baby, yeah? Please take care of my baby, okay?
Sure.
Okay, so your colleague went out already. So after that,
I also went somewhere. Suddenly turning back. See.
okay, so in fact, you going to the toilet.
Okay.
Okay, the baby happily playing with the Lego, right? Then after you went to toilet very long, about 10 minutes.
Okay.
Okay, so after 10 minutes, you came back. This is what happened. Let's see. You see?
Okay.
Totally not moving. Seems like no breathing. You call from far. The 1-year-old baby is not responding to you.
Okay.
Okay? So, the baby is here. What are you going to do now?
I look for the danger, then response. Baby, get up.
Okay.
Okay, the baby no response.
No response.
Okay.
Then I will try. No response. Should I go with CPR or should I try
No,
because?
you don't know what was happening.
Yeah. So I will go
You
with
went to the
CPR.
toilet 10 minutes that long. You don't know what was happened.
Okay. So I'll go with CPR.
Before you start CPR, you need to confirm what? 3 things you need to confirm.
Responsiveness first, and then
No response.
brachial artery pulsation.
No pulse.
Then respiratory rate, no respiration.
No breathing.
Yeah. So
Okay.
3.
Now,
So
what are you going to do?
I will start with CPR first.
Okay, start. Your friend's still not coming back, so you alone now.
Yeah. So 1, 2, 3, 4. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I will be checking if there is possibility.
No, you don't know what's happening.
Yeah, so okay, I'll just give 2 breathe,
Okay.
and by the time my friend has come.
So you summon your friend to come. Okay, your friend coming back now. Your friend coming, what happened to my baby? Oh my god! What you did to my baby?
I don't know.
Okay, never mind. Now, what happened? What should I do now? What should I do now?
Please call emergency 999.
999?
Yeah.
Okay, I call. Yeah, go and call. Okay, I already called them. I said baby not moving at all. They're coming. What should I do now?
Okay, so we will do CPR.
Yes. What should I do? What should I do? I never learned basic life support.
Do you have AED at home?
AD? What is that? I don't know what's that.
It's an external.
Whatever is that I don't have. What should I do now?
Okay, so we will do CPR now.
Okay.
Okay, so I'll hold the baby.
Okay.
1, 2, 3, 4, 5, 6, 7.
Oh,
8,
I know.
9, 10,
Okay.
11,
5 years ago I learned before. I need to give the
14,
I need to give
15.
briefing, right?
Yeah.
Okay, I give briefing. How many times I should give?
2.
Okay. 1. Chest
2.
rise. Yes. 2.
Okay.
Chest rise. Yes.
Yeah. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Can you give me?
1. Chest rise. Yes. 2. Chest rise. Yes. Okay.
This
so
we continue.
meanwhile, the ambulance arrived. Okay. Shafia is the ambulance MA. Okay. So now you come already. You of course you came with the AED. All right. So okay. You do. I don't know what to do. Now, what you should do?
Now let's just put the baby.
How to put How to put?
One in front and one in the back.
Oh, okay. The mother is happily learning now.
Yeah. And put the baby back.
And
Okay,
then
clear first because we want to
Yeah.
analyze.
Adult patient.
Actually, you're
Give the
wrong.
patient.
we should first on. and
When the
then
AD arrive, you on
On.
first.
Oh,
yeah.
Okay. After that, choose your pad,
Patient
No.
chest.
place on the baby. Okay.
Remove packet and apply pads on the patient.
Okay. Now what to do?
we
Child
will
patient.
listen to that and
Must continue compression,
Child
right?
shirt.
Yeah. You,
Analyze.
Remove packet and apply pads.
They haven't
on the
asked you to
child
analyze yet.
chest.
okay. The AD not asking you to analyze yet, so you need to continue.
And chest as
You
shown.
should minimize interruption between compression.
compression.
Yes.
Remove packet and apply pad on the child's bare skin.
15.
Okay, remove and apply already. You
Apply
continue.
pads to child's
Then
back
you-
and chest as shown in the pictures.
I continue, bro.
Remove package and apply pads onto child's bare skin. Apply pads to child's back and chest as
Why
shown in
video?
the
What
picture.
you want to continue on?
15.
Press pads firmly on skin. Apply pads to press pads firmly on skin. Do not touch the patient.
Okay, do not
Analyzing
touch the patient.
heart rhythm.
Listen to the AD.
Do not
AD saying,
touch the
don't
patient.
touch.
Analyzing heart rhythm.
Because the
Shock
AD is,
advised.
okay, shock advice.
Do not touch the patient.
Oh,
Everyone
I clear,
clear.
you clear.
Everybody clear. Okay, never mind, never
Press
mind.
the flashing
So
shock
I just, you know the idea. We just
Press the shock
pretend.
button now.
Okay, never
Shock.
mind. Okay, so we go with no shock advice. Okay, imagine no shock advice. So what are you going to do now?
Continue with
CPR. All right, now continue your CPR. So you are the medical assistant, right? So you help with the
6, 7, 8,
airway.
10, 11, 12, 13, 14, 15.
15 compression,
Two.
2 breath. 1, chest rise, yes.
2,
Chest rise,
Chest rise.
yes.
I'll continue. I'm very tired. We will exchange.
Okay, you should exchange the role after how
2
many
minutes.
cycles?
2 minutes.
10.
minutes.
2 minutes. 2 minutes? 10 cycles, right? Already 2 minutes?
Yeah.
Not yet.
My hand is paining, so 2 minutes over.
Okay, imagine already 2 minutes
Yeah.
or already 10 cycles. You
Exchange.
exchange, right? Now do the real thing.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5.
Okay, 15 compression. 1 cycle done. Okay, continue. Do the real thing.
3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5.
Okay. 2 breath. Okay. Alright. So now, again, high quality CPR for baby. Okay. How to do high quality CPR for infant? Shafia? Okay. The rate of compression. How many rates per minute? How many compression per minute?
Compression per minute for infant.
Yes.
30.
How many compression per minute?
Per minute.
200? 300?
100 to 120.
Yes, 100 to 120. Okay.
Breathing should be every 2 to 3.
Okay, for one person CPR, high quality CPR, how many compression, how many breath? One person. Just now when you never arrived, Prof. Kumar alone, if he's alone, how many compression you should do?
30 compression, 2, 3.
Breath. Okay. After she arrived, it's a 2-man CPR. 2-man CPR, how many compression?
15 compression, 2 breathing.
Yes, correct. Okay. So whether it's 32 or 52, 1 minute, how many compression you should press? How is the rate of compression?
100 to 120.
100 to 120. Okay. How deep you should press for a less than 1-year-old baby?
4.3.
4 centimeter. 4 centimeter.
Yes, correct. 4 centimeters. Okay. After you press, you should allow chest to recoil. Okay. And for baby to open the airway, can you do the jaw thrust?
Not because baby is so small.
Yes. So instead, when you open the airway, you should do
Head to chin.
okay. Head till chin lift. How to perform head till chin lift? Tell me step by step.
We have to keep 2 fingers in the chin region and 1 hand in the head,
Head region.
and then tilt it slowly.
Okay.
Uh,
Then in the baby, you should put your mouth wrap around there.
Nose and mouth.
Yes. In the baby, the mouth and the nose is very near. So when you do the wrapping, you want to force the air inside, the breathing inside, you should wrap both the nose and the mouth together.
Together.
If you only wrap the mouth, what is happening?
We close the airway.
We never close the airway
Yeah.
properly. Okay, so you're giving a not efficient. Okay, understand? Okay, very good. Okay, thank you, baby bean. Okay, so we rest first. to our summary part. Okay, I will summarize all those details for you. Okay. So first of all, CPR, adult, child and infant, two different things. Okay, two different techniques. For compression rate, adult is the same, 100 to 120 compression per minute. And for child and infant, compression rate per minute also the same, 100 to 120. It's just that the ratio is different. Adult is 30 compression, 2 breathing. 30 compression, 2 breathing. But for child and infant, 1 man CPR, 30 compression, 2 breathing. 2 man CPR, 15 compression, 2 breathing. Okay? So the compression rate is 100 to 120 without pauses between for the breath. Okay? And this is advanced airway. Advanced airway means it is not our job already. Advanced airway usually including the incubation. Okay, usually it's from the advanced medical team that will do that. After they insert the incubation, they will continue the compression without giving breathing because the tube already in. The breathing continuously giving, so you don't need to pause for the compression. Okay, right? So ventilation, rescue breathing. Okay, after the advanced breathing is in already, the ventilation you continuously giving. For example, you have the ambu bag, you connect the tube, the intratracheal tube. So if you are the one who hold the ambu bag, so you're going to give rescue breathing. The rescue breathing is not like 2 and stop for the compression, then 2 and stop for the compression. No, you continuously give the rescue breathing. Okay. For adult is 1 breath every 6 seconds. Means pump 2, 3, 4, 5, 6. Pump 2, 3, 4, 5, 6. Every 6 seconds. For infant and children, it's every pump 2, 3. Pump 2, 3. Okay? Right? This is rescue breathing. So, same, it's the same thing. Adult, 1 breath every 6 seconds. Infant and child, 1 breath every 2 to 3 seconds. Okay? So, give each breath in 1 second. And each breath should result in visible chest rise. Okay? If no chest rise means the breathing you're giving is not effective. Okay? And check for the pulse every 2 minutes. Means every 5 cycles of CPR, you need to check the pulse. If there's pulse already, you do so hard, you do the compression 32, 5 cycles, you check the pulse. If the victim's pulse is there, are you continuing with the CPR? No. Are you going to continue? No, because of pulse. The 3 criteria to start CPR is no pulse, no breathing, no, it's not responsive. Got pulse already means patient is revived already. So no need to continue with your CPR. So at the end of the session, I'm going to do assessment for you all. Right? I'm going to give you quiz. So join the quiz, please. Scan and join the quiz.
Okay.
So everyone join. Yoshika joining.
You don't have to jump.
Okay, so now let's start with the quiz. So we have how many participants here? Okay, 4 participants. SK, who is SK?
No.
Yoshika, I know. Yoshika is very honest. Okay. Fifi, who is Fifi?
Me.
Fifi, you. Okay, GGK, you, right? Hey, wait, what is wrong?
GTK is me, SK is her.
Okay, yeah, EGK, you're SK. Okay, never mind. Anyhow, we should start.
Anyway, I'm going to get top, so I'll say GTK got top.
We're going to start now, huh? Let's start. So we have 5 questions, each question 30 seconds. Huh? So the greatest chance of survival in cardiac arrest victim occurs when CPR begin at A. Within 4 minutes of arrest. B. Oh my god. I haven't. Okay, very good. No need me to read out the answer, everybody can get the correct answer, okay? So yes, the correct answer is within 4 minutes of cardiac arrest. Okay, 4 minutes after don't have oxygen, what happened is we have brain cell damage, alright? If after 4 minutes we still don't have people to come and help the victim with CPR and give oxygenation, what will happen is Up to 10 minutes, what will happen? Bring biological
Biological
death.
death.
Okay? 4 minutes is clinical death. 10 minutes is? Yes, very good. Biological death is reversible or not reversible? It is permanent. Okay? It's not reversible. Very good. So next question. The ratio of compression to ventilation in adult one-man CPR is A. 15 to 2, B. 30 to 2, C. 15 to 2, 5 cycles, D. 30 to 2, 5 cycles. The A is 4 cycle, B is 4 cycle, C is 5 cycle, D is 5 cycle. Come. Everyone answer? Okay, everyone answer. Very good. Okay, so the correct answer is yes, D. 30 to 2, 5 cycles. Everyone got it correct. Very good. So next, number 3. Okay, there's one man holding a neck, coughing, responding. Okay, what will you do? A. Immediately start hemorrhage manual. B. Give him back slap between the shoulder blades. C. Sweep out the victim's mouth with your finger. D. Do nothing, stand by and encourage the victim to cough. Okay. Only 3 people answered. You answered?
I also answered.
Okay, never mind. Okay. Everybody answer B, right?
Yeah.
Okay, very good. I think what is the system? Okay, number 4. You noted one victim collapsed in the MRT. Is not responsive, not breathing. You're not sure whether there's a carotid pulse or not. So now what you should do? A. Start with chest compression. B. Deliver 5 abdominal thrusts. C. Check femoral pulse. D. Relocate the pulse and feel again. Oh, okay. So 2 chose begin chest compression. Another 2 chose check the femoral pulse. Who are the one who check begin the chest compression? So both of you are correct, lah. Okay, so Prof. Uma and Yoshika, you choose check the femoral pulse. Okay, it's actually if you are not sure, or not, actually you can start with B. You don't check again. Okay, between maximum 10 seconds. Okay, you should start with B. Don't check again. Okay, and don't relocate your pulse and feel again. It's actually dragging the time. Alright? Okay, now. The last question, So in 2-man adult CPR, when do you switch rescuer? A. When the compressor is tired, ask for a change. B. After every 5 cycles or 2 minutes of CPR. C. When the ventilator is tired and ask for a change. D. At the end of 10 cycles of minimum interruption. Okay, so 3 answered B after 5 cycles or 2 minutes of CPR. 1 answer when the compressor is tired and ask for a change. Who is the one who answer after 5 cycles and 2 minutes? You, and you. Yoshika, you answered when the compressor is tired and ask for a change, right? No. At least you should finish 2 minutes first. Okay? At least you should finish 2 minutes first or 5 cycles first. Then only ask for change. Okay? Because 5 cycles is just 2 minutes. 2 minutes I think everybody can.
More abdominal thrust with hemorrhage removal. So I can suddenly I got all the brain problem.
Alright, so let's see who is the best student. Okay? First student should go to those who answer most correct one and answer the fastest. Okay? It's
Yes!
who is escape?
I am escape!
You are escape?
No.
GGK.
I remember you are GGK.
No, my name is Arun Kumar.
Okay.
Okay, who is the best student?
Yes!
Okay,
the pig nose.
Okay, very good, very good.
Thank you, Dr. Gauri.
Alright, so
I can answer all the questions.
okay, so before I end my session, any question to me? Any question?
So far, no question. We can
Really? No question?
we can understand
You're
it.
happy?
We are
Yeah,
happy. We
thank
can
you,
understand
thank you.
all the slide.
Alright. Okay, thank you so
We
much.
refresh our
Thank you.
Okay, so you all don't have question, right? I have question for you. I have question for you, right? So let me ask one by one. Start from Dr. Gauri. Okay. Okay. So for mild airway obstruction, what is the first step you need to do? Mild airway obstruction.
So I have to encourage the patient
Okay.
cough and help himself
To cough out the project. Do you do pop 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 like that? No, Okay, very good. So your part. Okay. For conscious baby, okay, what is the first step you need to do? Conscious baby. Conscious choking baby. Sorry.
In conscious choking baby, I have to, maybe in the sense infant, right? Like, I have to take it and I have to keep the baby horizontal and turn, and then tap on the back 5 times.
So it's called back.
Low. Okay.
How many times you do
5
the back
times.
rows? 5 times. After that,
I have to check for the
turn over.
turn over and see the
The foreign
mouth,
object.
whether there is any foreign object or not.
Okay. If there's foreign object, what do you do?
I will put my little finger in a
Okay.
U-shaped manner and
Okay.
take it out.
Alright. Yes, good. Okay. If you don't see any foreign object, do you do blind swab?
No, I don't do the blood swab.
Okay,
but
then?
I will try.
No. You already do back load. Okay.
So you
Sorry.
Sorry,
Compression.
CPR.
No, that's not called CPR.
It is just compression. I have to
Okay,
keep it like this and
you do the back load, right?
Abdominal thrust.
5 times. Okay. After that, you turn over and
And
check whether there's any foreign
foreign
object.
object or not.
If no foreign object,
Then chest compression.
Chest thrust.
chest thrust.
Thrust.
How many times?
30.
5 times.
How many chest thrusts you need to do? 5
Five.
times. 2, 3, 4, 5. And after that, go back low again. Okay? Do until when?
15 minutes.
Until they throw out the object.
Until the object is up.
But this
Or
they become unconscious.
baby become not responsive.
Uh,
Okay? Can So in unresponsive baby, do you check for pulse?
no,
No. Okay, because why?
we don't want to waste the time.
You don't waste that because you witness
Yeah,
the choking
Yeah.
became unconscious.
Yeah.
So no need to check
No
pulse,
need to check for
but you need to
pulse.
check for responsiveness
responsiveness and
And?
go for
the chest rise.
yes,
Alright?
correct.
Okay. Shafia, for 2-man CPR in baby, what is the ratio? Compression to breath ratio.
15 compression to breath.
Okay. For 1-man CPR in baby, what is the compression to breath ratio?
30 compression to breath.
Good.
Thank you, Dr. Gauri.
That's all. Thank you
SK.
for joining my
Oh,
session.
SK.
Thank you, Dr. SK.
Let's breath.
Thank you, doctor. Thank you so much.
So your sugar is 2 hours.